it's Dr. Pip Penrose here in Stratford. I'm going to share with you an exercise today that I've used for probably my whole time in practice, and I've used it as the basis for core strengthening for many people who have asked me what to do. I've had big buff weightlifters who have asked, and this is what I've given them to give them some good foundation for their core. I've had dancers and gymnasts that I've used this for. I've had moms postpartum, and I've even had people who've never done any workout at all. So it's a great starting point for core and something I recommend that you give a try. If you have any questions, feel free to reach out. Good luck. Enjoy. Hello, my friends. Here's a funny video with me on the floor. But I've had a lot of people talking about some core stability work that they are either doing or want to do. And what happens is we get into doing a lot of crunches and a lot of fancy stuff with your legs going up and down and all kinds of things. And so what we're finding, and I've even seen it in some really young, really high level dancers, is that our core isn't always as strong as it needs to be to do all that fancy stuff. And quite frankly, for a lot of us, we don't need to be able to do anything like this ever. So we don't need to be putting that much torque through us. We can do it in a much safer way. So one of my favorite things to do with people is to simply have them put their hands under the small of their back. And so you're gonna slip those hands right in under the small of your back. And then what you're gonna do is use these lower abdominal muscles and press down on those hands so that you're feeling the tightening right between those hip bones. So you could even put one hand down here. So I'll leave my back hand in there. And then put the other hand almost like it's in your pocket. So it's wrapped around this hip bone and you can feel that nice soft tummy there. And so what you're gonna do is you're gonna feel this area down here firm up so that you're pressing into that hand that's on the floor. The other thing that I want you to watch for is that you're not doing this to flatten that back. So we shouldn't feel all this pressure here, and you should be able to breathe. So for example, I'm pressing down on that hand right now and I can still breathe. Now I've been practicing it a few years, so it should be a little bit easier, but that's something you're gonna work towards and pay attention to. And then what I have people do is while they are pushing down those hands and focusing on some contraction here, you can also contract your pelvic floor if that helps you hold things. And all you're gonna do is lift one leg up. And what you wanna feel is that you don't do this as you lift it up. And so very often what happens is people lift like that. So what we wanna do is get really nice, good stability so that you can lift that leg up. And it's just, this leg is just hanging out. It's not doing anything fancy. And then pop that back down. And then lift the other one up. And you're just bringing it up to sort of, till your thigh is vertical. And bringing it back down. If you want to get really fancy, you can bring that leg back up. And then from here, you can drop it all the way down, but not again if you're going to do this. So you have to hold that nice and steady, drop that leg down, and bring it back up and hold it down. Most people aren't perfect at this to begin with, but what you're really trying to do is learn to stabilize across here so that again, we're not seeing a lot of this, right? So I've seen tons of dancers, gymnasts, all kinds of people who look strong. They've got the six pack. They can do all kinds of cool things with their legs. But what's happening is all the way along, this low back is getting so much torque through it. And so then they're coming in with low back pain as young as 8, 9, and 10. And it simply is that lack of core stability. So what we really want to be able to do again is to be able to hold those hands down firm. So you can put your hands here, or if you're younger, mom and dad can put their hands here, and you just practice this exercise. And once you can hold nice and firmly and you're not seeing any loosening as you pick up that leg, then you can progress to being able to drop it down and bring it back up. There you go. Just a little quick tip for you. Give that a try. If you have any questions, feel free to reach out and ask me. Thanks for watching, everybody. I hope that was really helpful for you. If at any point you have any questions, feel free to message me directly. All my contact info is going to be below. And remember to visit your chiropractor. Good luck.